The following is an article from Health Magazine, Fall 2024 edition, published by the Southwest Utah Public Health Foundation.
Travel Health by Tamsy Thompson, RN, guest contributor. I love traveling. I get to meet so many people and learn about cultures that are very different from mine. Many countries I visited are still developing their public health practices and have higher rates of infectious disease than we do in the United States. Knowing what to look out for will make your international travel experience safer and more enjoyable. I once sat down at a restaurant in Peru with two other solo travelers I had met. My new friends ordered a local delicacy called ceviche, which is raw fish cured with lemon juice and salt. One of my dining companions said, "I saved the ceviche until the end of my trip, just in case I get sick." While he said it was delicious, I stuck to my thoroughly cooked seafood risotto. I did not want to tempt fate. Around 25% of people report diarrhea while traveling internationally, usually caused by consuming food or water that has been contaminated by bacteria, viruses, or parasites. In some countries, it is not safe to get ice in drinks, brush your teeth with tap water, or eat raw fruits and vegetables. Using basic hygiene, drinking bottled water, and eating foods that are thoroughly cooked and served hot are the main ways to prevent getting a stomach bug. Getting vaccinated against hepatitis A and typhoid fever will also help protect you against common foodborne illnesses. The only time I had diarrhea while traveling was on a cruise ship. 90% of gastrointestinal outbreaks on cruises are caused by norovirus or common cause of vomiting and diarrhea. Symptoms can be treated with a Pepto-Bismol or Imodium, which is more expensive if you buy it on the ship. Some types of travelers' diarrhea may not respond to these medications, so your doctor or a travel clinic should be consulted for recommendations. Be prepared for any voyage by taking a first aid kit that includes over-the-counter and prescription medications. You don't need to know everything about your destination, but some basic research can help you be prepared depending on where and when you're going. Essential information would include weather forecasts, disease outbreaks, current political situation, healthcare, travel insurance, how much money to bring based on the exchange rate, basic words and phrases in the local language, maps of the area, driving rules, and phone internet access. When I went to China, I noticed that several travelers in my group were affected by the air pollution and unfamiliar spicy food. Others were uncomfortable with the custom of bartering with vendors, and a few of them asked me to get souvenirs for them because I had done it before and knew the rules. While traveling with my sisters in Scotland, I was the only one who checked the weather beforehand. While the light jackets they brought would normally be fine for April, my winter jacket was a better choice for the cold front that came through and dropped 6 inches of snow in Edinburgh. I wasn't quite as prepared when I was in Vancouver, Canada, by myself to do some hiking and see Christmas lights. While I knew it was going to rain, I underestimated how the cold, wet air would affect my asthma. I hadn't brought my inhaler like I should have, which is a reminder to always take extra medications and keep them with your carry-on luggage in your original packaging. Check with the country's embassy on what medicine you are allowed to bring, since there are several countries that have strict regulations, even for products like Benadryl and Sudafed. Altitude is another topic to consider, especially if you live at a lower elevation. Since our bodies need time to adjust, going higher than 5,000 feet a day carries the risk of altitude sickness. Back in Peru, I witnessed multiple tourists who were struggling to breathe at high elevation sites. You can condition yourself by hiking and staying overnight at higher altitudes before your trip, and your doctor can prescribe medication that can prevent and treat altitude sickness. You'll also want to drink plenty of fluids and eat small, consistent meals. Speaking of eating, as I parted ways with my two dinner companions who had taken a risk with Peruvian ceviche, we all agreed that the people we met there were some of the kindest we had ever encountered. It's a beautiful world out there, yet by comparison, we probably take for granted how safe our food, water, and environment are back home.
If this episode kept you alert and informed, mission accomplished.